Hey everybody, Dr. Rob Greger with Longevity Health and Fitness. I wanted to talk this morning a little bit more about acupuncture. I get a lot of questions about acupuncture. What is it? How does it work? Do the needles hurt? All these different questions about acupuncture. One of the things I just wanted to cover today, I just want to show you a quick demonstration on what we do with the needles, what the needles look like, and how we insert them. This is kind of a little tool that we use just to show the meridians. Basically, there are multiple points on the body, hundreds of points, thousands, depending on the combinations that you use and the different models that you pay attention to. But there are specific points along energetic meridians. Basically, they can follow muscular pathways or what we consider to be even things like the myofascial slings. A lot of the meridians follow those myofascial slings, or vice versa. The slings follow the meridians. It's an energy pathway. We are big batteries. So if there's a blockage in energy, like a trigger point, or a myofascial tension, or some kind of a shortened muscle, or a joint restriction, speaking as a chiropractor, joint restrictions are huge for blocking energy. Energy is just a matter of how we function. We eat food, it turns into energy. Energetics sometimes gets a bad rap. People get a little confused about it. They start to turn it into a little hocus pocus. But the reality is, if you don't eat and fuel your body with energy or nutrition, what Chinese medicine calls gu qi, it will not turn into qi or energy or calories. However you want to call calories a calorie, energy is energy, fuel is fuel. So if that fuel can't get from point A to point B, and we can't get function out of a muscle, function out of a joint, we're going to have trouble. One way to help restore that function is by using acupuncture. Acupuncture uses a small solid shaft needle. There's nothing going in, nothing coming out as far as that goes, as far as fluid or exchange. It's not like getting your blood drawn. Most people think about that big old needle. Basically, it comes in this little guide tube. The guide tube is generally what you feel. The needle itself is very small. If you look here, it's kind of hard to see, but you look here, this is the shaft of the needle. This is the needle itself, very flimsy, very small. This length is pretty average, but you generally only use a little bit of this needle, the very tip here, kind of this first little bit. Now what happens is we put this needle inside the guide tube here. We put that to a point. We find the point that we're looking for. We make sure that we clean the point with alcohol. We get that point there. We set that needle there, and it's just a nice little tap, and then that needle's in place. Sometimes we play with the needle just a little bit. We put it in there. There may be a little bit of a heavy feeling. Sometimes we call it strong, or sometimes we call it, just a little bit of a heaviness or an uncomfortableness. Basically, you're looking for that which they call the arrival of the qi. Hopefully you get a chance to come on in. Let me know if you have any questions. We'll see you again next time.